Hi, my name is Jill Pitchford,
And I am Megan Brown.
and we're third-year doctoral students in the audiology program here at Ball State. We have created a doctoral project to act as a professional development to give additional resources to teachers who may have students with hearing loss in their classroom. All right, so 1 in 3 per 1,000 infants are born with hearing loss in the United States. And approximately 60 to 80% of those students, when they get older and go off to school, they are being taught in general education classrooms. But through research, we found that general knowledge on hearing health has been shown to be a little lacking. And so our objective with this presentation is to provide knowledge on hearing loss and teaching strategies to help better support students with hearing loss and to help teachers to support students with hearing loss. So we created a survey first, and we did that last fall, I believe, and we created this survey to assess teachers' comfort and preparedness of working with students with hearing loss. So we got a total of 94 responses, and most of them were general education teachers. One of the questions that we asked them was if they felt that they were sufficiently prepared to teach students when they were studying to become a teacher, to work with students with hearing loss. And over half of our participants that answered the survey said that they were either neutral or disagreed with that statement. So they felt that they were not sufficiently prepared. And another question that we asked was if they were specifically taught about students with hearing loss in their studies, and only 17% said yes. So because we were kind of surprised by this number, we decided to create a presentation to discuss hearing loss and how it impacts those students, as well as devices that you may see as a teacher and some strategies to use in the classroom. So the degree of hearing loss can range. So you could have a mild hearing loss, moderate, severe, or even a profound hearing loss. On the more mild side, that might just be a student who might have difficulty hearing over background noise. But as it gets worse and they get a more profound hearing loss, they cannot hear most everyday sounds unless they have amplifications, unless they have hearing aids in. And more severe hearing losses are usually identified before a child enters school. So mostly when they're babies, they might not start babbling until later, or they might not say their first word until sufficiently later. And so their parents might have their hearing tested before they even enter school. The more mild to moderate hearing losses are sometimes missed, as they're harder to identify in young children because they don't exactly tell you when they can't hear something. So they're often reluctant to speak up when they can't hear well, and they kind of just keep going along and just don't say anything. So we've listed some patterns that you can kind of watch for that might mean that they might have a hearing loss. So they might ask teachers or other people to repeat themselves a lot, or say what a lot. They might start to speak differently than children of the same age. So they might have like a speech disorder, or you can just tell if their speech is different. They might not reply when their name is called, or they might respond inappropriately to questions. They might watch other people or other kids of their same age. They might intimidate or imitate what they're doing. They might struggle in school and complain of ear pain or head noise. And you might notice that they ask you to turn the volume up really loud on the TV, tablet, or computers. So I'll kind of go over hearing in general. So our ears are made up of 3 different parts. You have the outer ear, the middle ear, and the inner ear. So you can see on this diagram here that the outer ear is orange, the middle ear is pink, and the inner ear is blue. So sound waves enter into the ear canal and hit the eardrum. The vibrations from the eardrum set the 3 middle ear bones into motion in in that in that pink part on the picture here. And those 3 ear bones help to amplify the sound and transfer the sound waves into the inner ear. So the sound waves enter the cochlea, which is that snail-shaped organ that's light blue in this picture. And that organ is filled with fluid. And that fluid, in response to the vibrations, triggers nerve endings, and that sends the signal to the brain. So we're able to kind of understand and make sense of the sound. So now I'll talk about different types of hearing losses. So first I'll talk about conductive hearing loss. This is a pretty common one that you might see. This is pretty common in younger children. This is created by a problem in the outer or middle ear. So it could be both. But you can see on this little diagram, the X's on the outer and middle ear, just kind of indicating that that's where the problem lies. So sound is just unable to travel through to the inner ear or through the outer ear and to the eardrum and the middle ear bones. This type of hearing loss could range from mild to moderate, and it makes it hard to hear soft sounds, and louder sounds may be muffled. This type of hearing loss causes limited access to sounds and makes speech and language development very difficult for these types of children. School performance can be affected, and amplification and intervention services may be required. The best way to kind of understand what a conductive hearing loss sounds like is to put some earplugs in, or to stick your fingers up and plug up both of your ears. That's kind of the best way for somebody with normal hearing to simulate what these people might be going through. Where if you were to have a conversation with earplugs in, you might be able to hear that person, but it's understanding that person that is the tricky part. So they can understand, or they can hear loud sounds, but they just can't understand them. Common causes of this type of hearing loss can include fluid in the middle ear space. This could be caused by allergies or colds, ear infections, a buildup of earwax. So small children tend to produce a lot of earwax. So if that were ever to become so much that it just impacts the outer ear, it can just stop the sound from going any further into their ear. There can also be a poor eustachian tube dysfunction that causes it. And the eustachian tube is a narrow passageway that connects the upper part of the throat to the middle ear. So you can see it in this picture that I have here. This passageway helps to regulate the pressure behind the eardrum and the middle ear space and keeps the middle ear free of fluid. So in children, you can see in this picture that their eustachian tube is relatively flat and horizontal. While as we get older, that tends to angle down a little bit more, making it easier for the fluid to drain out. And in children, they're just more susceptible to fluid buildup because of how flat it is, and it's just harder for that fluid to drain. And the untreated fluid, if it were to build up back there behind the middle ear, it could just cause it to be infected, and an untreated ear infection can lead to permanent damage. Another cause could be a hole in the eardrum or a benign tumor. These tumors are not usually cancerous, but they can block the outer or middle ear, just kind of causing a blockage of that sound. Or they could just have a problem with how the outer or middle ear was formed in utero. So some people are just born without an outer ear, or it's deformed, or the ear canal is closed, or the bones in the middle ear weren't formed properly. There's a lot of different possibilities. some treatments for this type of hearing loss. These infections could be treated with antibiotics or pressure equalization tubes, which you might have heard of before, just to kind of help drain that fluid. If the cause of the hearing loss is due to congenital deformations, then surgery could help correct that hearing loss, or amplification, or hearing aids could be used as a solution, or bone anchored implants, which these devices will be discussed a little bit later. The next type of hearing loss that I'll talk about is the sensorineural hearing loss. So this is a problem caused by the inner ear, or the nerve endings that go up that connect to the brain. So just making it to where the sound, it just isn't able to actually go up to the brain. These hearing losses can range from mild to profound, and they could be congenital or at birth, or they could be acquired later in life. Common causes of sensorineural hearing loss could be genetics or hereditary factors. This type of hearing loss can run in families due to genes. It could be related to a diagnosed syndrome like Down syndrome. It could be caused by illnesses or infections, head injuries, noise exposure, medications. That's typically more seen in adults, but it can be seen in kids. Or if the mother experienced pregnancy complications like preeclampsia. And then, just like I discussed with conductive hearing loss, it could be a part of how the inner ear or the nerves were formed in utero. Amplification is the most common treatment for this type of hearing loss. If hearing aids don't work for them, if their hearing loss is so bad that hearing aids just don't help, then cochlear implants could be an option. And again, this will be discussed later. And then you have a unilateral hearing loss. So this type of hearing loss, it's kind of self-explanatory with unilateral, but it's hearing that's within normal limits in one ear and hearing that has some sort of hearing loss in the other ear. So some believe that this isn't necessarily a cause for concern because, hey, they can still hear out of one ear perfectly fine. But these people, or these children, can really struggle still because hearing with one ear is not the same as hearing with two ears. Approximately 15% of school-age children have significant hearing loss in at least one ear. Hearing with both ears allows our brain to be able to separate speech from background noise to better hear in noisy environments like restaurants or classrooms. So these students, if they have a unilateral hearing loss, can struggle greatly if there's a lot of other kids in the classroom and it's loud and noisy. Unilateral hearing loss can also affect children's ability to be able to take part in conversations and activities and can be really detrimental to their speech and language development. Some signs to look out for unilateral hearing loss could be that a student just has trouble knowing where the sounds are coming from. So they just have trouble localizing whether the sound is coming from in front of them, behind them, to their left or right. They just don't know where. They might have problems understanding speech in noisy places, as it's easier to focus on sounds when you can hear from both of your ears. And they might have problems hearing you from another room or outside, and they might withdraw from socialization with their peers because they just struggle to hear them. So they might just try to avoid it altogether.
So there's a few effects that hearing loss can have on development. So in the case of hearing loss in children, it can lead to delayed speech and language skills or learning problems in school, feeling bad about themselves because they have that hearing loss, and that may make them frustrated or have anxiety around it. Having trouble making friends, as Jill was talking about previously, they may withdraw from social situations, and that can cause them to have issues making friends. With words, they do not learn words as fast as other peers. So things like the, and, are, and a, they may not use those words in conversation. They may also have trouble distinguishing similar sounding words like bat, hat, and cat. In terms of speech, they may not use quiet sounds that are hard to hear, like S, SH, F, T, or K. They may not develop speech like their peers. They may also talk louder or quieter or even mumble, as they may not be able to hear their own voice and monitor it to determine, how loud or how soft they're speaking. In terms of social skills, hearing loss makes it harder to talk with others. They may not want to talk or play with other kids because of that frustration and that anxiety around that hearing loss. They may sometimes feel alone and like they have no friends, or they may be unhappy in school. In terms of school success, children with mild to moderate hearing loss could fall 1 to 4 grade levels behind without help. Children with more severe hearing loss may not learn past the 3rd or 4th grade without school support. Children with hearing loss will do better in school if they get help early. So early intervention is key with hearing loss, and identifying those children and getting them the help they need as soon as possible. And the gap between their school age peers will only grow over time if they don't have that proper help and support. So now we'll kind of talk about the devices you may see if these children do have hearing loss. So here are different device types that are available, and we will discuss in greater detail after this slide. Types of hearing aids you may see are behind the ear hearing aids, receiver in the canal hearing aids. And for in the canal hearing aids and in the ear hearing aids, I have stars next to those because those are custom options. As you can see in the picture on the right-hand side of the screen, there are those beige colored custom options. Those aren't typically seen in children. Those are more so used for adults. But most often you'll see the behind the ear and the receiver in the canal devices. Other devices are cochlear implants, bone anchored implants, and assistive listening devices such as an FM system. First, we'll discuss behind the ear hearing aids. So these are typically used for younger children or those with severe to profound hearing loss. These devices are the most durable behind the ear hearing aids, which is why you will see them in younger children. They can't break down as easily with repeated, bending or use or what have you. In younger children, there will also likely be safeties on these hearing aids, such as tamper-proof battery doors so they can't get the battery out, disabled volume control, and soft silicone ear molds on the end of them that go in the ear as opposed to harder acrylic. If they bump their head on the monkey bars or something like that, that will help have that soft piece in the ear so it's not as harmful if they do hit their head. Hearing aids made for children typically come in fun colors, as you can see, and the ear molds also can be made into a lot of different color and color combinations as well. Just a few days ago, I saw an ear mold that had dinosaurs on them. So there really can be endless options for that. Next, we have a receiver in the canal hearing aids, or RIC hearing aids. These consist of small wire with a dome on the end of it, pretty comparable to the end of an earbud that goes into the ear. These devices are less durable because of that wire and are more susceptible to damage with repeated use, pulling out of the ear, things like that. They can get shorts in them and break down more so than the other devices can. And because of that, they are less likely to be seen in younger children. These hearing aids, as you can see on the left-hand side, are virtually invisible. And they also can come in fun colors depending on what brand of hearing aid the audiologist decides to go with. Next, I'll talk about cochlear implants. So those are solutions for those with moderately severe to profound sensory neural hearing loss or auditory neuropathy that show little to no benefit with hearing aids. These can also be a solution for single-sided deafness, depending on the severity of the hearing loss. What a cochlear implant is, it is an electrode placed in the cochlea that directly stimulates the hearing nerve electrically instead of acoustically. It consists of an external portion that attaches to a magnet just under the skin on the side to back of the head. Some children may describe the implant as sounding very robotic or like Mickey Mouse. That is because listening electrically versus acoustically can be very different and can take a lot of time to get used to depending on when the child is implanted. So depending if they were implanted pretty close to birth or if they are older and they were implanted a little later in life. It is important with these kids that are implanted later in life to be very patient, as it can be very frustrating if they're used to hearing acoustically rather than electrically. The picture above is just one example of what a cochlear implant may look like. You may also see an external processor that does not have the part that sits on the ear, and it may only have one part that magnetizes to the head. Next, we'll talk about bone-anchored implants. So this is a solution for those with conductive hearing loss or single-sided deafness. In terms of conductive hearing loss, this implant directly stimulates the inner ear and bypasses the problematic middle ear. With single-sided deafness, the implant will allow the child to have sound awareness on the impaired side. So with the addition of sound awareness back to the impaired side, this can help with, things that we've talked about previously, such as sound localization that can be impaired with one-sided hearing loss and being able to discern speech from background noise. In the picture, this option can have surgical and non-surgical options. So in this picture, you see one of the non-surgical options, which consists of the sound processor being placed on a soft headband that is worn. Traditionally, for the surgical option, the sound processor would be placed on an abutment that is screwed into the surface of the skull, but there are also magnetic options available, such as similar to the ones we discussed with the cochlear implant. Next, we'll talk about FM systems. So what these are is they are assistive listening devices that wirelessly transmit signals to help those with hearing difficulties hear better amongst background noise. So it's essentially like a tiny little radio station with its own frequency, and it consists of two parts: a microphone that the speaker wears and a receiver worn in the ears or in the hearing aids of a child with hearing impairment that sends the speaker's voice directly into the ears. What the purpose of this is it overcomes the signal to noise ratio, or how loud speech is when compared to background noise. So now that we finished talking about devices, we'll talk about maybe the reason you're listening. So here are some teaching strategies that you could implement in your classroom that can be beneficial to help these kids that may have hearing impairment. So making sure you have eye contact with the child so they know you are talking to them. So also making sure to get their attention before you start talking can be very beneficial to help them understand the conversation and what you're saying better. In a perfect world where masks are no longer a thing, the child may also look at you to lip read to further understand what you are saying. Now, this doesn't mean you need to over exaggerate your lip movements. Just slow down slightly so they're able to pick up all words that are said in the conversation. Next, louder is not always the way to go. In a lot of cases of hearing loss, clarity of speech is the thing that is compromised, not volume. So in these cases, it is better to enunciate your speech, use visual aids or cues, and to frequently make sure all students are on the same page. Some children with hearing loss may have difficulty understanding idioms, sarcasm, and figures of speech. So if you are teaching those in class, if you're in that unit in your lesson, it may be beneficial to explicitly explain those and what they mean. So you can make sure that all kids understand the same way. Make sure to repeat questions asked in class from other students or other teachers' aides to ensure that all kids know what the question is and can follow along in conversation. If possible, use captioned videos or films if you're using those as teaching tools. That way it's easier for everybody to follow along. Even kids with normal hearing will likely benefit if you're using captioned materials and tools. It may also be difficult for students with hearing loss to try to listen to lectures and take notes at the same time. So if you can beforehand, try and provide written notes when able to help that student learn and follow along. Next, preferential seating and classroom arrangements are very important. Preferential seating is important for children with hearing loss. So being up by where you are teaching most of the time will help them to stay focused and hear the best that they're able to. Other things that can help this is to try and avoid seating arrangements where students have their back to the teacher or in circle type arrangements. Lastly, it may be beneficial for male teachers to keep facial hair well groomed, so mustache and beard, as not to cover their mouth for the purposes of lip reading and other facial cues. So sometimes students may need help with their devices. We have made some troubleshooting videos in order to help with the basic needs of hearing aids. We are still in the process of editing these videos, but we plan on distributing them when they are complete so teachers can have easy access to them. Here is an example of what they will look like. So this video is an example of how you would replace a battery in hearing aids.
Hi, my name is Megan, and in this video, we will be talking about how to check to see if your students' hearing aids are working properly. First, we will discuss the behind-the-ear style hearing aids. The first step in making sure a hearing aid is working is to check the battery. An easy way to check if the hearing aid has power is to place the hearing aid in the palm of your hand and lightly enclose the hearing aid in your hand. If the hearing aid is on and working, you should hear a squealing sound. If you do not hear the squealing sound, the hearing aid battery might be dead. To change the battery, you find the ledge located at the bottom of the hearing aid and pull to open the battery door. Some devices may have a childproof lock to prevent the battery door from opening for younger children, and we will discuss how to open those later.
All right, so that is all we have for you. Thank you so much for coming and taking the time to listen to our presentation. If you do have any questions, don't hesitate to email us. We will provide our email with the link to this presentation when we do send it out. So don't hesitate to reach out to us and give us your questions.
We hope we have provided some information that can be helpful for you guys in the classroom. So thanks for watching.